Hi, I'm Cheung. I'm the clinical professor of the Department of Orthopaedics and Traumatology at the University of Hong Kong. Today, I'll be describing a project that we've been developing in our team. An app helps us to diagnose and monitor scoliosis. Scoliosis is a three-dimensional deformity of the spinal column. Basically means that there's twisting of the spinal column. And most of these patients are pediatric patients. We need to intervene at an early stage to prevent it from getting worse. Try to avoid that by prescribing some non-operative treatments early. With COVID, we actually had a poor experience of patients not being able to visit the clinic to be screened. And so we devised this plan of trying to avoid having patients really be present to be assessed, to give them access to healthcare without seeing a doctor in the clinic.
I'm Zhang. I'm in charge of the digital health laboratory at the University of Hong Kong. So what our app can provide is a more accessible method of evaluating their disease and managing their treatment course. Firstly, we provide a photo-based spine deformity or scoliosis evaluation, so they can just stay at home and take a photo of their back, and our AI model will be able to give them recommendations of whether the disease is a progression or we need a particular reassessment and a clinical visit. Through the follow-up, with the support of our previous data set, we can actually predict whether the patient is at risk of a disease progression or growth spurt.
We've done studies which have been published showing that the accuracy is pretty much the same on par with a professional. Beyond that, of course, is management. We have developed a module that provides personalized AI-driven scoliosis-specific exercise catered towards the patient's size as well as the patient's cob angle assessment. It improves the mental health of our patients and their families. They don't have to worry too much about whether the curve has got worse or not. They can do it comforted at home without actually coming to the clinic. We're not trying to replace the doctor, the professional who provides the advice and also the social interaction. I think that's still very important, and that actually probably saves some unnecessary visits to clinic, so we can actually reduce the amount of radiation exposure.
To improve the patient adherence to the treatment via the app is significantly important. We have the data showing if the doctor is checking up with the patient via the inbox of the app, that the patient will be more promptly to launch the app. So by improving that patient and doctor interaction module, in the future we'll be able to improve the patient compliance further.
We're actually discussing with hospital authority very closely to try to get this into our public system so that our patients will be able to utilize it. We are running already the service in mainland China as well as some private clinics.
The collaboration with Professor Zhang is particularly important, as we actually very keen to know the real clinical needs, real doctors' needs, and real patients' needs. We don't want to just develop an AI because the engineers think that is important, and then we start to look for the application in a clinical setting.
I think this is a perfect harmony in terms of having a clinician and engineer to work together. Especially in HKUMed, we have this dogma where a clinician and a basic scientist working together will create the best outcomes. And this is a perfect example of myself as a clinician bringing forth the problems that we face in the clinical arena, and having Dr. Zhang as an engineer provide solutions is the best form of collaboration. We're working towards expanding beyond spine and scoliosis to other orthopedic conditions and even other specialties. And we hope we can bring this technology to the other fields in medicine.